common case which we see in the GP clinic. A 32-year-old man presents with ear pain and a small amount of bleeding after scratching his ear with a matchstick. He's concerned that he may have ruptured his eardrum. On otoscopic examination, the tympanic membrane shows a traumatic perforation. This is a case of traumatic tympanic membrane rupture. As family physicians, it is important to remember that most traumatic tympanic membrane perforations are clean perforations. This means that the tympanic membrane was previously healthy, and in most cases, there is no need for aggressive intervention. The main management is reassurance and follow-up. These perforations usually heal spontaneously, most commonly within 1 month, and sometimes may take up to 3 to 6 months. The most important instructions to be given to the patient is to keep the ear dry. That is really important. To keep the ear dry, advise the patient to take a cotton ball, soak it in a Vaseline, and gently place it in the ear during bathing. The patient should avoid allowing water to enter the affected ear. During follow-up, 2 things are essential to assess. First, examine the appearance of the tympanic membrane to ensure that healing is taking place. Second, assess the hearing of the patient either clinically or with audiometry if needed. If the tympanic membrane is healing and hearing remains normal, simple follow-up is sufficient. Follow-up can be continued for 1 month up to 6 months, although most cases heal within the first month. So, as a summary, the case we have just seen is a case of traumatic tympanic membrane perforation. And always remember, these are most traumatic tympanic membrane perforations are clean perforations, which means the tympanic membrane is healthy. It was not diseased or was not having any bacterial or fungal infection. So, the most important thing is these perforations usually heal spontaneously within a period of 1 month. Okay, and the most important instruction to be given to the patient is to keep the ear dry. That is really important. And on follow-up, we have to check 2 things. First is the appearance of the tympanic membrane with a otoscope. And the second thing is to assess the hearing of the patient. I hope you like the video and you like the stuff we have discussed today, which is a common case in the general practice. Thank you so much for listening to this video.